Susan. Greetings, everyone, and welcome to this session on the economics of women's health. And thank you to the WEF for making this a mainstream session at the World Economic Forum. It's held, of course, in the context of the WEF's Women's Health Initiative. And that initiative was launched with the aim of obviously contributing to the health and well-being of the world's 3.9 billion women and girls. Now, it seems that we cannot state too often the case for investment in the health of women and girls. All the evidence tells us that obviously not only is it a good thing in its own right for women and girls, but it contributes to the overall economic performance of countries, families, that healthier women are part of more successful, more educated, more productive societies, that families with improved reproductive and maternal health are families which can report higher earnings in the longer run, that every dollar we spend on family planning services, and Natalia no doubt will talk more about this, just has so many return benefits in many ways for health and economies. So all up, it's a good thing, but why isn't there more of it is then the question that immediately follows. And I guess those are some of the issues we want to explore with our panel today. Let's also acknowledge what an appalling setback COVID has been for the health and well-being of women and girls, not only in loss of access during lockdowns in many countries to reproductive and sexual health services, but also the many millions of girls that we're told will never go back to school after the lockdowns because of impoverishment of families, the domestic violence that came from it, the list is long. So we've got setbacks and we've got big challenges with the Sustainable Development Goals and gender equality. But let's hope from the combined wisdom of our panel today, we can go away with some insights and ideas as to how things can be speeded along. So, wonderful panel. I have right next to me the Minister of Women and Child Development of India. Next to the Minister is Kevin Ali, Chief Executive Officer and member of the board of Organon. Then, next to Kevin, Natalia Kanem of the UN Population Fund, Executive Director, and way along the end, almost out of sight, but definitely not out of mind, is Mark Suzman, Chief Executive Officer of the Bill and Melinda Gates Foundation, and let's acknowledge what tremendous supporters the Gates Foundation has been of investing in women and girls. So, Minister, can we start with you? There's a need to have high-level political engagement in order to create a healthier, gender equitable and child-centred world. Tell us from your perspective why you think investing in women and girl child development should be such a priority.
I think that if we lead from example and expressions of many policy interventions in India with respect to health per se, there are a few takeaways from that experience. The world's largest and one of the most expansive healthcare programs in India is currently underway, called the Ayushman Bharat Yojana, which covers 100 million families from marginalized communities, from low-income group communities. They encompass close to services in 26,000 hospitals across the country, where the government gives free support for medical support in over 1,300 diseases. And at the same time, what it does is that it is transferable with a migration of people from one region to another geography. What it also does is, as it covers the huge expanse of the healthcare needs of those who are marginalized, it also brings to fore many achievements which have a societal impact or which have an impact with regards to some cultural narratives. I'll give you a very small example. People believed that in Indian society, issues such as breast cancer, cancer of the cervix, are not issues that will be popularly spoken of because women would be not as aggressive about their healthcare needs, or for that matter in this segment, not get the adequate support that they so desire. One of the outcomes of the health program called Ayushman Bharat is that in the past 1.5 years, numbers suggest that over 130 million Indian women, because of the support of this very program, have reached out to medical facilities across the country, gotten themselves scanned for cancer of the cervix and cancer of the breast. After scanning, if they are in need of a medical intervention, have received that support from these medical institutions. Now, this is a number which is unheard of, especially in a segment of medication where people feel that we will not be so culturally exposed, which means that another interesting insight it throws up is that when women are enabled in terms of access and fiscal support, there is not a single healthcare need that they will not address themselves. The other aspect, which becomes a huge burden in terms of the financial aspects of any family unit, is when you spend on pharmacology. And the Prime Minister was extremely keen to ensure that there is an available infrastructure in every district and every block of India, which makes sure that any medicine that you need, be it for cardiovascular diseases, be it for diabetes, be it even a stent, it is available at prices which are affordable. Now, that means when you enable a family to save on pharmacy needs, that is an added plus to the family's income. Now, in that matrix, there is a special disposition for 40 female health-related products. Let me give you a small example. Never in the history of my country, from the ramparts of the Red Fort on Independence Day, has any Prime Minister spoken of the availability of a sanitary pad for ₹1. That a male Prime Minister, and with all my respects to the gender that I'm speaking of, could give India our first menstrual hygiene administrative protocol. So when we talk about how to put the gender agenda at the forefront of healthcare, do we only take the refuge of, let's say, an insurance-based program like Ayushman Bharat? No. Where is the legislative need or gap that needs to be filled to complement our efforts of gender justice? For 4 decades in my country, there was a bill pending, legislative support, which basically pronounced support through administration and medical communities for medical termination of pregnancy at 24 weeks. That it passed both houses of parliament without a whimper from any man or any political entity speaks volume about the maturity of the Indian populace and polity with regards to medical needs for women. That we have now enhanced maternity benefit for working women to up to 26 weeks is also something that we celebrate as women in my country. Apart from that, I think that there is a conscious effort on behalf of the government to ensure that the whole life cycle needs of a woman's health is looked after by every government entity. For example, I lead the Gender Ministry in India. We run the world's largest nutrition program in the world. The Prime Minister started a flagship program, which is an amalgam of 18 ministries in the government of India. It's never happened before. And we, through a technology engagement, service the needs and nutritional delivery at the doorsteps for 120 million Indian women and children below the age of 6. It is a collaboration between citizens and government, but it is a collaboration which has done us well, especially in the pandemic. Ms. Clark, with your permission, given the time constraints, let me just expand beyond the relevance of, let's say, Ayushman Bharat. Many a times we define health needs as the immediate health needs of a woman that needs to be addressed. There are evolutions in health needs, especially given our labor markets, especially given women in distress. So the Prime Minister led the establishment of emergency and crisis centers for women, particularly in every district of my country. There are 703 such emergency crisis centers which are currently functional, which were open for business even during the global lockdown, where we finance additionally 35 women's helplines. And we have combined in our federal structure helped close to 220 million women in distress, given them medical, psychological, and police help so that they can transition from challenges towards solutions. So if we look at the needs of women, not only from, let's say, issues of cardiovascular diseases, menstrual health, but even mental health, That is a huge prospect where we can see enhanced partnerships between the private sector and those who are policymakers. When you invest in the health of a woman, you invest in the health of a community, because she's not singular to keeping or restraining that benefit to herself. When you empower her financially, she tends to spend more on health and education. So let's look at healthcare from both perspectives, not only from the infrastructural engagement, but also when we fiscally empower women in other segments of society, we give them more purchasing power in the health sector.
Well, thank you very much for putting all of those issues on the table, and there's clearly very important elements of universal health coverage that you've talked about, and also universal basic social protection as well. And great to see the attention to the silent killers like breast cancer and cervical cancer, and also the cause of menstrual hygiene, which, as we know, is the lack of it keeps so many girls out of continuing with their schooling, which is disastrous. So thank you so much for those insights. Kevin, let's come to you as Chief Executive Officer and member of the Organon board. Gender equity and women's health are intrinsically entwined in the success of societies, but we've seen women's health isn't always prioritised. From your perspective, why has progress been a bit slow? And just make any comments you'd like to make about how you see this changing.
Well, thank you for the question. I would tell you that we could spend quite a bit of time just discussing that very topic, and I'll try to be concise from the point of view of the biopharmaceutical sector, which I'm a leader of one of those companies in Organon. Look, sustainable development goals in terms of things like reduction of maternal mortality. Over the last 17 years, it's an average of about 3 percentage points a year reduction, when SDG, basically says that it should be about 6%. When we look at unintended pregnancy rates, globally they're about 50%. 50%, 5 out of every 10 pregnancies were unintended. And so we all know that for many girls and many women, that could basically lead them astray from being able to have their own development and their own opportunities in life in terms of education and opportunities to go after. Postpartum hemorrhage. A woman dies every 3 minutes somewhere in the world from the complication of delivery, which shouldn't be the case. Preterm labor. There's about 1 million children a year that are born in a preterm labor state, and the complications and the mortality and the morbidity associated with preterm labor. Not enough innovation has really actually been generated and focused on some of these things in terms of maternal care, in terms of reproductive health, for example, unintended pregnancies, in terms of a number of areas. Even I'll throw out fertility. One would think that IVF therapies should be something that can solve some of the fertility needs around the world. But when you look today, even at the Asian Pacific countries, in the Asian Pacific Rim, you need 2.1 in terms of per family, in terms of reproducing the population. In Korea, it's 0.7. By the end of the century, Korea will be half the size as it is today. You can see some of the issues. You read in the Wall Street Journal, Natalia and I talked about this, that China is actually about 1.5. China is having a population issue. So all of that tells you that there's needed investment in the opportunities to bring innovation in that space. And that's where the idea of Organon was kind of born, to essentially be a company that has many businesses, but the direction of travel is really about investment in women's health, to increase the investment in innovation. If I give you a sobering statistic, of the 37 products that were approved by the FDA last year, only 3 were essentially targeting those conditions unique to women. So there's much more that needs to be there. Now, here's the good news. The good news is there are green shoots of innovation across the world, ranging from kind of the fast emerging area of femtech all the way to therapeutic advances as well. We ourselves at Organon have actually, since the 1.5 years we've been live, since we rang the bell at the New York Stock Exchange, we've done 8 deals, 2 in the medical device space, one, to solve the issues of postpartum hemorrhage, one, to solve the issue of some of the issues around minimally invasive hysterectomies, all the way to new mechanisms of action for endometriosis, preterm labor, polycystic ovary syndrome. Those are areas we're investing in because investment is the key. Now, the reason there hasn't been investment over the years is very simple. Our industry, the pharmaceutical industry, is usually not gender focused. They're agnostic of that. They actually focus on the innovation in the R&D space, whoever it actually supports. But we feel there are opportunities at Organon to really invest in women's health, not only reproductive health, not only maternal health, but in gynecological conditions as well, because the industry needs to see, yes, we believe this is a noble cause, but is it a viable, sustainable commercial enterprise? And if commercially there are more and more innovations and more return on that investment, then it will serve as almost a magnet. It will magnetize the industry to start investing more in areas of women's health, both distinctly women's health as well as those conditions uniquely or disproportionately actually impacting women, everything from celiac disease to chronic cough to migraine to osteoporosis. More needs to be done in this space. That's the bottom line. There are green shoots of innovation. I think Organon is being one that actually rings the bell, that you can have a noble cause and sustainable, viable commercial enterprise that ultimately can feed itself so that ultimately it goes forward. Because anytime we think of women's health as some sort of corporate social responsibility, it'll go up and it'll go down depending on the time that we're in. But if it's a viable commercial enterprise, then it will be there for the long term.
Thank you, Kevin. And coming to Natalia, do you see green shoots? Are we going to overcome the barriers?
I see green shoots precisely because women are no longer taking a back seat, and as half the world's population, the demands on the political system, and I think we've had beautiful examples of transformation when women's needs are prioritized, as well as the understanding that women themselves are stepping up to lead on these issues. I think the examples that Kevin just put on the table for Organon in terms of the wealth of possibility, monetary wealth, but also wealth in terms of health as wealth. So from my perspective, looking at certain barriers of why are women's needs not prioritized brings us back to this issue of making the case, but making the case with evidence is not always enough. So the transformation of the understanding of especially an adolescent girl, of her human rights, of her self-worth, of her right to exist in a digital space, of her right to not only lead, but to consume products that are good for her and for her mental health. These are the green shoots that not just the private sector, but us as United Nations, as public sector, as regular citizens, as fathers who support daughters, we all have to embrace. So it is disturbing that as we look across the spectrum of lack of priority, COVID-19 told us everything we need to know about a health workforce that's almost 3/4 female, and midwives that UNFPA support were scrambling for raincoats and other manner of PPE-like barriers to be able to treat people in distress. As has been alluded to, the life cycle of women from prenatal, where nutrition is crucial and important, all the way to older age. And in a world of 8 billion, many of us are aging, but many women are voting with their feet when it comes to the size of their family. I advocate, of course, for family planning, and we've seen the wisdom and the high return of almost $10 for every dollar you invest in family planning and maternal health. So the monetary case can be made. But you also need to make the case for, at a time when there is so much heterogeneity and different experiences in countries, there are still 300 million women who want to access family planning that are knocking on the door of a clinic and nobody is there. So looking at universal health care as one of the keynote examples of sustainable development, The woman who wants to limit her family size has to be catered to, as well as the woman who's stigmatized because of infertility, or frankly, who's choosing not to have a first or second child because she can figure out the economics of trying to get a kid through school and college and the shoes and the books and everything else. So the role of innovation is going to be mission critical. My last point is on geographic disparity, and Minister, you alluded to this. Where you live, you could be at the top of the hill in an island location. Your human right to health exists. So looking at geography and innovation and some of the tech solutions that we can use to overcome those sound barriers, but also just simple primary health care, this is what's going to make a difference for women. But listening to the voices of women who are saying, this is what we need, this is what we want, and we're not going to wait 100 years for the wage situation to equalize, et cetera, that's going to be the accelerator that we need.
Thank you, Natalia. And of course, in those years of waiting you're referring to, it's the WEF's own Global Gender Gap report, which the figures for the year before the pandemic showed 100 years to full gender equality. Then we had the horror year of 2020, reported on the 2021 report, which said 136 years, because that's how much things had regressed for women. And then the latest one, based on the 2021 data, says 132 years. So we're impatient, aren't we? We don't think that's an appropriate time to wait for full equality. But the investments in this kind of area are part of what's going to make the difference. And that leads me to come to Mark Suzman and say, Mark, from the perspective of the Gates Foundation, what do you think are the most critical global health investments to be made now for women and girls?
Yeah, so, well, thank you, and thanks to the panel for already raising so many of the critical issues. And actually, where Helen started, it remains this paradox. Even here we are at sort of Davos, who's thinking about global prosperity writ large, where we know there is no single investment or set of investments beyond investing in the health, education, and agency of girls and women that has a better social and economic payoff. Full stop. That's an uncontested fact. But yet, as a community, whether it's from the Davos agendas to the representation to the time frame of 132 versus 136 years, it's, as a world, we are not remotely close to where we could or should be. And so that does pull you into, well, where and how are the investments that could and should be prioritized and shifted? And at the Gates Foundation, we've actually been through our own sort of learning on where we've always prioritized health and women's health from our foundation, from our establishment as a foundation in 2000. We've learned ourselves that we actually haven't always gone around it in a way that appropriately both listens to the needs of stakeholders, brings in the communities, targets particular opportunities need, and you want to look at it across the spectrum. So at one level, one of the sets of investments is exactly what the minister was just talking about in India, and India has been a model in many ways of some of the things from the development of tools like women's self-help groups and empowerment collectives that are able to collectively provide agency that get you health and financial and economic outputs, and we think that is an incredibly important tool that can and should be spread in other parts of the world, whether it's that linkage in on nutrition that we talked about, because nutrition is such a critical enabler for both healthy pregnancies, healthy birth, prevention of morbidity, and then providing those opportunities for later schools and access. But then more broadly, the kind of medical interventions we talked about, and this is how we've evolved our own thinking. So, for example, there's both into the core research and development. Let's take an area where we are prioritizing significant investment right now is there are treatments for anemia, but investment in anemia, which actually is one of the most fundamental challenges facing women, and particularly women in pregnancy, and the related effect on it, is far, far short of what could and should be being done. So we are trying to pick areas like that where we think there are promising new interventions and new science that can be as priorities. Similarly, in the area of nutrition, the better understanding of the microbiome, which there are lots of companies sort of doing expanded research in to figure out how to do better weight loss, but our research can focus specifically in what elements of treating the microbiome can actually be most important in the antenatal and postnatal period for women and children? And can you have, again, some transformative investments? And we actually think the potential there is huge. And so that's the kind of example of scientific areas where a foundation like ours can prioritize and target research and development, which is not naturally going there from private companies or others, even though, arguably it could or should be, but we think could have a disproportionate effect. But it's not just the development of the products. It's also then the distribution and pricing and access. As Natalia was talking about, some of that excess of need, say, in family planning, is how can you spread a different array of family planning products to make sure that women have full availability of choice. There we've had partnerships, including with UNFPA, where you take some existing products, which we know are of increasing popularity, such as injectable contraceptives, and what we would work with was a couple of private sector companies who didn't think there were markets in low and lower middle income countries. And so we would arrange some deals that would include, in this case, there were volume guarantees saying, we think there is a market. So if you halve the price of your product, we will guarantee, as the Gates Foundation, to make up if you don't actually make a profit at that price and reach your market. They made a profit, they met their market, twice as many women got access to the product as they would. There are also ways in which you can produce or distribute the treatment or prioritize the treatment of new interventions. We mentioned cervical cancer. The HPV vaccine is a critical vaccine that has been developed and rolled out across much of the world and is trying to, it's well short of what's needed as a major priority of Gavi. There's some exciting new products, including product research from some Indian and other companies around it. At the Gates Foundation, we were able to provide and do some research as a public good, which showed the efficacy of a single dose of HPV is as much as the current thing of multiple doses. That basically allows you to vaccinate twice as many children for the same amount of. Again, it's a study that anybody could or should have done, potentially. But it's an area where when you step in the gap in the public good, that allows you to actually reach many more women. So it's that combination of trying to identify both the key areas of research and development, then the access of the products, and then last but not least, and maybe this can come back to that with the rest of the panel, is that how do you then arrange the delivery of it through the public health systems, through systems like India's significant networks and the Ayushman Bharat program, through other tools, because that's that last mile that actually has to reach the women and children that need to get access.
Yes, and indeed a role of foundations, I think, to look for those niches which aren't being picked up necessarily by others and show what can be done. So thank you for those insights. I'd like to bring our audience in. We've got a full room and the hands are going up already, and we'll be gender equal in what we take. So there, you're first and you're next. Please introduce yourselves. Sure. Yeah, and maybe do you want to wait for the microphone? Maybe stand up so people can see you as well.
Hello, everyone. I'm Sangu Deli from Ghana, and I'm a healthcare entrepreneur. I run a tech-forward healthcare system with 65 hospitals and clinics across Africa, and we serve 1 million patients. So when it comes to this issue of women's health in particular, on the African continent, we're about 1.3 billion today. We're about 16% of global population, yet we're responsible for 25% of the global disease burden. We only have 3% of global healthcare workers and 1% of global healthcare expenditure. Yet if you look at demographic projections, by 2050, 1 in 4 people globally will be African. 70% of the world's youth globally are going to be in Africa. In fact, more people are going to enter the workforce in Africa that year than the rest of the world combined. So literally over the next 2 decades and change, we expect over 1 billion babies to be born in Africa. Yet, if we look at what's happening with our doctor-to-patient ratio and the chronic shortages that are starting to happen in the West, every single day, the biggest challenge I have in my hospitals are doctors and nurses being poached to go overseas. Yet we're the continent that needs these resources the most. So pragmatically speaking, what can we do to ensure that the continent that is going to be the world's future and is going to produce the future workforce will be able to have the right infrastructure and the right personnel to be able to build our healthcare future. Thank you.
Natalia, can I give you a go at that one?
Well, you've absolutely succinctly gotten to the heart of the matter, which is equity, and also the question of the future of the global world, because Africa, in a sense, leads in the disease burden, but also the innovation, the imagination, and those young people who have to be equipped also come from Africa, and Asia too will be part of the burgeoning population increase. But the rights and choices of an individual girl, but also of the nurse, the doctor, et cetera, being buttressed at home makes so much more sense than trying to export them and or play the catch-up. So the wisdom of the African Minister of Finance, the health system, universal health coverage system, of building a workforce, for example, midwives, who were trying to double the availability of midwifery, looking at primary care, but also making it more attractive for the workforce, and many of them, the preponderance of them being female, is part of the solutions orientation that our panel represents today. And I think that solution is coming from private sector actors who are the bulwark of the health system in Africa like everywhere else. So the donated contraception that UNFPA provides is all very well and good, but women are paying for services. So thank you for the question, and I think that really well summarizes the urgency of the types of innovation and social policy that we tried to put on the table.
Christina.
So, thank you. Can you hear me? Okay.
Yes.
I'm Christina Lloyd, and I'm the global leader of the Pharynx, Reproductive Medicine Maternal Health portfolio. And first of all, I would like to thank all of you here, and I'm really happy that Pharynx is a part of co-championing this forum's flagship, this initiative, which we're really proud of being here. And I also would like to thank Organon for joining us here and together, and then you and UNFPA and Howard School of Public Health. So that's fantastic. So we are here in this coalition to try to work together. And I think we are sitting here and everything we say, should nobody say no, we don't need that. Why don't we turn everything upside down? We have to create a common narrative. And this is also what we are doing in this coalition. And we are also creating a white paper based on data, investments cases, and we are trying to build business models that everyone can understand. So, I would also like to say that, listening to everyone here, I'm a gynecologist and obstetrician myself. I've actually been saved lives during my days. And then I was in healthcare with good equipment, medicine, and everything. So I do understand this is the purpose, and this is also what we as actually competitors are working together, and this is the beauty of it, I think. So my question is, back to the narrative, that how can we do that to even more create this clarity of why it is a smart thing to invest in women's and girls' health? It's not about cost. We're not talking about cost of healthcare. We are talking about investment in healthcare. And we were at this meeting this morning, the same thing again. So can you please tell me, what could the narrative, what could the story be to ministers of health and head of states and CEOs and so on around the world, so we can create a common narrative? Because we all have our stories, and I'm so impressed to listening to what you're doing. And so once again, how can we create that, and what could this question be, and what can we ask them to do?
Well, I'm going to throw that question to the Minister of Women and Child Development of India, because listening to you, Minister, I think there've been some very compelling arguments which have loosened the purse strings to do important things.
I think it's not about loosening the purse strings. It is about spending what is in the purse mindfully. There are 3 things that I'd like to hear flagged, Christina. One is, do we look at healthcare very myopically? Can there be a bigger narrative around women's health? Let me give you another Indian example. The Prime Minister in 2014, when he took office, spoke again very unusually about a very unglamorous subject, which was that can we build toilets for women? Now, when he said that, he spoke not only from a perspective of sanitation, healthcare, he spoke about it from an education point of view, as Helen has said, that there are many girls who drop out the minute they are part of the menstrual cycle age. In 1 year, we built toilets in every government school in the country. We curtailed dropouts. However, on a larger scale, the government built 110 million individual household toilets. Now, people would presume that there's a health benefit to it. In the 2013, there was a World Bank report that because of lack of sanitation services, there is a negative burden of 6% on Indian GDP. So while he was addressing a gender justice issue, he ended up addressing an economic issue, but also a law and order issue. Because there were reports out there in public that 40% of sexual violence took place when women went out to defecate. So when we look at issues of women's health or women's dignity or justice, there is a multiplier effect when you try and reach one solution. Now, apart from loosening up the purse strings, it is about partnerships. So Mark has very eloquently spoken about what the Gates Foundation has done. But what is significant about what he said is that they help fund the confidence that is needed to transition from failure to success. To say that injectables will find a wider market till such time a partnership evolves from, let's say, a foundation like the Gates Foundation, supporting industry, impacting policymakers. I think we need more and more players who will bridge that gap. So apart from only looking at an initiative on women's health from the myopia of possible infrastructure, from the myopia of only policy making, it is us on this panel who are a part of the solution. No individual entity in governance or the capital market or corporate infrastructure can be the answer alone. I also feel that another myopia that we are inflicted by is when we talk about women's health, we speak about women from a constituency of consumption. How many of us are very focused on health innovators who are women, who do frontier breakthrough work on research, but do not know how to convert those innovations into enterprise? Because there are many entrepreneurial ventures, innovations which are cost effective, given the diversity of geographies, which are culturally easier to ingest by many countries when they evolve very organically from communities. How much of our concentration from a healthcare perspective is even on those innovations? Lastly, from a talent point of view, I had a gentleman speak about the African challenge. How do you address that challenge from an academic perspective? We in India, under the Prime Minister's leadership now, have institutionalized healthcare education in every district of the country. Not only doctors, paramedics, nursing communities, those who are indulging in telemedicine. It is a huge ecosystem that needs to evolve and find successive support across segments of policymaking, governance, civil society, and corporates. So if we start looking at the system as a whole and start addressing it as a coalition, Mark spoke about in India a coalition of women who are entrepreneurial in nature, 80 million of them. They manage credit only within that segment of close to $32 billion every year. They are available in every village in India. They scale up and skill up on the supply chain from a crafts perspective, agro-processing perspective, but they become agents of change when it comes to health and when it comes to academics for women. So how do we find new resources for communication with regards to women's health? And lastly, speaking as a mother of 2 kids, what we do as women, irrespective of our financial background, we tend to put ourselves last when it comes to our pharmacological needs and diagnostic needs. no matter who you are, no matter where you are, you do this as a woman. Your diagnostics needs are the last refuge in your healthcare framework. So can we have more education and conversation around the diagnostic needs and the pharmacological needs? Because currently most of the conversation is about what do you do when you're in trouble? How much are we investing or how much are we strategizing with regards to preventive healthcare when it comes to women and young girls?
Can I ask, do we have Cynthia McCaffrey in the room? Yes, Cynthia, from UNICEF. No, take your question, Cynthia, and then I'll bring others in.
My name is Cynthia McCaffrey. I work at UNICEF India, and I actually have worked, I feel like, for 4 of you on stage, because I've been at UNICEF for a long time, so UNDP, Gates, UNFPA. And now in India, I work for the minister. So we're a partner, but we're very proud to help implement the incredible, very tangible initiatives that, as you talked about, Anyawandi, frontline workers, for example, getting people trained. My question is picking up on this point about women are beneficiaries, but how to make them more of the shareholders and the decision makers around healthcare, so that they're the real players when it comes to building this global health ecosystem.
Let's start with Mark down the far end. I can still see you.
Yeah, well, I mean, it's a great set of questions, and that is the fundamental issue. And you know, there's no one set of interventions. It's a whole scale of interventions from, you know, the models and examples that you do address and bring in at a policy level with, you know, finance ministers and prime ministers, you know, who often don't have the same kind of leadership that the minister was talking about in India, need to be educated as to why and how this is so critically important, and you can link in those economic issues. It's about proving the products and the models so that you can show that that's true whether you're at a district level, whether you're for the communities themselves, for mothers to know if you're, you know, investing in this, in the nutrition of your children or whatever it might be, you're going to get these outcomes, and then you've got the tools and things available for them. But it's also about, you know, I started with that sense of a women's sense of sort of agency and purpose, and we know that that is still such a fundamental barrier for a whole range of those going well beyond healthcare. But to take one example, that, you know, by putting all of our health areas together, our maternal child health areas, into a wider gender equality team, which we did a couple of years, linking it to our women's economic empowerment, it's allowed us, for example, to do work which we'd been meaning to do for a while, but it ended up being completely siloized for adolescent girls and young women, where you say for the agency for prevention, for example, we know that the highest incidence for HIV incidence remains 16 to 24-year-old young girls and women, particularly in sub-Saharan Africa. And, you know, the intervention, it's not simply about getting access to the PrEP tools. It's a set of behaviors, agencies, understanding the motivation, understanding the routes by which they might be able to access that kind of healthcare. And that's true because that's that same group needing to access family planning products. It's the same group we want to make sure are staying in school and being educated. It's the same group we want to be sure are perhaps joining some of those self-help groups as they come in more rural areas. It's the same group who we hope are getting a ladder in a bank account or agency and so on. And so I think, you know, there's a short-term sets of interventions around those specific things, but there's also just the long-term connective tissue of building those connections and understanding that starts with basically providing power and agency to the women and girls themselves, because that's the best way of demanding those outcomes and results.
Time is always against us, and we could get so much more from this panel and from the audience, which we really don't have time for. But I think we've had a wonderful mix of the practical examples from the Minister of what can be done. Kevin, loved your sort of, you know, can do, there's opportunities to innovate in this area. UNFPA and Natalia are always out there, you know, advocating, making the case, and actually delivering in real time to so many. And Mark, you know, Gates out there looking for the neglected areas and how to support women and girls in this area. So some great takeaways. I'm going to call on Shyam, who's head of the healthcare practice here at the WEF, for his concluding comments.
Thank you, Helen. And as you said, we are out of time, so I'm going to be very quick here. First of all, thank you for moderating such an excellent panel discussion. I mean, we're so glad to hear from you, Minister Irani, from Kevin, CEO of Organon, from Natalia, UNFPA, from Mark Suzman, CEO of Foundation. So you can see Gates Foundation. So you can see you have the public sector, private sector, United Nations, and the charity philanthropic organization here. So bringing all this together, listening to you, that excites me. Yeah. That tells me that we are thinking about women's health. We are going to do something about it. So this is an exciting time. One thing I would like to just bring it to your attention, especially to you, Minister Irani, and we were discussing this earlier today in a healthcare policy session. We had two health ministers. We had the health minister from Germany, we had the health minister from India, and we had a few finance ministers. We had the ex-prime minister of UK, Tony Blair, there in that session. And it was very clear that now we are talking about investing in healthcare. We are talking about, especially the finance ministers, they were talking about healthcare as investment and not as a cost.
Yeah.
So this is really good to hear. I want to hear the same thing for women's health, that it is an investment. And like our ex-Secretary General Kofi Annan, UN Secretary General, said, investing in women is reducing poverty.
That's right.
So that is very important, and it's happening now. So on the G20 side, I know India is holding presidency for G20 for this year. We have been talking to Ministry of Health and Welfare. I think it would be great for us, all of us, to lobby to highlight women's health as one of the health agenda for G20. So that would be my request to you.
Done.
And with that, I know we are out of time, so I would like to thank everyone for being here.
Thank you. Great. Thanks.
And we may